So, welcome to a new video where we are going to discuss the part 2 of the respiratory system. Okay, in the part 1, already like we have described about the basic anatomy, the functions of the respiratory system, the functions of the respiratory membrane, then the compliance. Then we have discussed the work of breathing and all, like the flow resistance, elastic work. The applied portion is also described, like the obstructive restrictive disease, what happens basically. So now we are in the part 2 of the video where we are going to start with the oxygen transport. Okay, so basically what is the need for oxygen transport? So basically the oxygen transport is required for, like, oxygen is required for all cells for their metabolism, especially for energy production, like the electron transport chain, or for to be specific, more specific, the tricarboxylic acid cycle. Oxygen is very much important, or if oxygen is not present, then anaerobic glycolysis occur and we get comparably a very short amount of ATP. So oxygen is needed by all cells for energy production mainly, and all others metabolic processes. Okay, then how is oxygen transport? Okay, so oxygen is transported in two types. Okay, it is bounded by hemoglobin, bounded by Hb, and another is dissolved in plasma. Okay, so the amount of oxygen which is bounded by hemoglobin is much more greater, like it is above 95 percentage, or let's say 98 or 99 percentage, and the dissolved state in plasma is very much less. Okay, so what is the exact value? So bounded by Hb is around, it is around 15 to 16 gram. Okay, so 15 gram of O2 in 100 ml of blood. Okay, so basically to talk about the bounded by Hb, so 15 gram of O2 is in 100 gram of 100 ml of blood. Okay, so basically, like, let me just mention it. I have mentioned it in indirect way. So basically what is the concentration of O2 in hemoglobin? So 1.34, around 1.34 or ml of O2 is present. Okay, is present in each hemoglobin molecule. Okay, so like each hemoglobin molecule. Okay, just me write each Hb molecule. Okay, so each hemoglobin consists of 1.3 ml of O2. Now, like we said, the other way is dissolved in plasma. So around 0.29 ml of O2 is in 100 ml of blood, is in 100 ml of blood. So we can see the difference. 15 gram of O2 in 100 ml of blood with bounded by Hb, and dissolved in plasma is 0.29 ml of O2 in 100 ml of blood. So the difference is too much. So therefore the main transport mechanism is bounded by hemoglobin. Okay, now one very much important topic to be discussed in this O2 transport kind of thing is the oxygen hemoglobin dissociation curve. Okay, it is pretty much important curve. Okay, so let me first draw it, then I will come. Okay, so I am back. Now this is the graph of the O2 hemoglobin dissociation curve. Since the graph says O2 hemoglobin dissociation curve, the pressure of oxygen in mmHg, or in millimeter of mercury is on the x-axis, and the Hb saturation in percentage, or the hemoglobin saturation in percentage, is on y-axis. So basically the graph looks like this. Just a second. Just let me draw it. So basically the graph is somewhat like this. Okay, so what is this meaning of the graph? The Hb saturation, what is the pressure of oxygen? So it says that, so basically the Hb saturation at 140 millimeter of mercury pressure, okay, is 100%, around 100%, 99 or 100%, it is around that range, okay, of where O2 pressure is around 140 to 145 millimeter of mercury. Okay, so somewhat like this point. Okay, we will consider this point. This is a little away from 140, but around this range, like the 135 to 145 is the range where the Hb saturation is 100%. Now the Hb saturation is like 100, 90 till 90. So from what, say this point, okay, from this point to this point, this is the oxygenated blood. Okay, oxygenated blood. And from where do this oxygenated blood come from? Yes, the lungs. So oxygenated blood from lungs. Okay, so this is the most pure oxygen containing blood, which is from the lungs. Okay, now when we talk about this segment, this particular segment, so basically this segment we are talking about, we can see the pressure of oxygen is decreasing. Okay, and also the Hb saturation is decreasing, like it is coming till 30 or till 20 percentage. Okay, so this is the, so basically tell me a logic, from where do we get the blood which is less in oxygen? Obviously from the tissues. Okay, it goes from the tissues. Basically we are talking about the venous return. Okay, so basically it is the reduced blood returning from tissues, or I used a word venous return. So basically I would like to mention venous return because it is the basic concept, the core concept. The venous return is less in Hb saturation, like the pressure of O2 is less, so O2 containing Hb is less, so the Hb saturation is less. Okay, so what is the advantage of this graph? This is the sigmoid curve, as we know. So what happens is O2 is bounded to hemoglobin. Okay, so when the oxygenated blood which contains 100%, like 100% saturation, hemoglobin is 100% saturated by oxygen. Okay, so in the lungs it is 100% saturated, in the tissue level or in the veins it is less saturated. Okay, so tell me one thing, if the pressure of oxygen, if it is reduced to 110, for example a random value 110, what will become to the saturation? It will not drop easily. Okay, let's say if we do the value to 90 or to 80, okay, so it will drop a bit, like it will be 90 or like 89, something like that. But now if I reduce the pressure to 65 or 70, somewhat like that value, so the saturation will get a drastic drop, as we have seen in the figure. See, if the value is, let's say 135, okay, this range, so what happens is the saturation is 100%, we can see. Okay, so near what, to 100. Okay, so this is the value. Now if I reduce to somewhat like 65, to this point. So till 65 we will get a drastic change. For example, we are getting 75, around 75 value, and if I go more further till 50, like I'm going till 50, I am getting a value close to 50. So only 50% Hb is saturated with oxygen. So basically what this graph teaches us, I will write the significance which is the most important of this graph. Okay, so the significance of graph is basically a drastic change in partial pressure of oxygen will not cause a decrease in hemoglobin concentration, or rather say hemoglobin saturation of oxygen. I would like to add one word which is the most important word, or the whole sentence will get, like, it will be a jumble or it will be a useless statement. A drastic change in partial pressure of oxygen, just a second, just a second guys. Okay, I will just rough it and I will write the whole statement. Okay, a drastic change in partial pressure of O2 within physiological terms or physiological limits will not change the Hb saturation drastically. So why have I added this within physiological limits? So basically within physiological limits means only one thing. If we like decrease the value till 50, okay, it is below the physiological limit, then we will get a lower saturation. If we reduce the value till 60, we get a lower saturation. If we reduce the value till 70, we also get a lower saturation. Till 80, it is like 85 to 100, it is okayish. Okay, so from 140 we are reducing till 85, it is fine, but after that it is the below physiological limit. So a drastic change in partial pressure of oxygen within physiological limits will not change the Hb saturation drastically. Okay, so there are some factors which affect the curve. Okay, so just I will write factors affecting O2 dissociation curve. So some factors basically causes the O2 dissociation curve to shift to right. Okay, so I have a personal trick to remember. Every time it is not right. Okay, this is my personal trick. It may be a little childish trick, but to remember I have applied this trick. So to shift to right is basically increase. When increase in partial pressure of carbon dioxide is there, the shift of the curve is right. Okay, when increase in H plus concentration and further increase in basicity, the increased hydrogen ion, then increase H plus ions. So basically acidic environment occurs, so the shift is moved to right. Okay, then increase temperature. Then last, but it is the most important, the increase in 2,3 BPG or 2,3 DPG. Better we will write it BPG. Okay, biphosphoglycerate. Okay, so the shift of right is observed when this condition is there, and the net result of shift is increased pH. Okay, so normal is 7.35 to 7.45. The pH can go till 7.2 or 7.25 to 7.30 or somewhat like that. Okay, factors which causes a shift to left. Okay, so everything is not right, so all the positive condition, so basically decrease in PCO2, okay, decrease in H plus ions or decrease in hydrogen ions concentration, basically a basic environment, decrease in temperature and decrease in 2,3 BPG. Okay, so these condition will cause the curve to shift to left, and basically a decrease in pH is observed. So basically, sorry, it is decrease in pH, basically acidic environment, and here it is increase in pH, a basic environment. So basically the pH can go till 7.6, 7.7 kind of thing, 7.6 to be more specific. Okay, so here it is basic condition, so increase in pH. In the shift to right, a decrease in pH as acidic condition. Let me just highlight it, a decrease in pH and an increase in pH here. Okay, now one important concept to be talked about is the Bohr effect. So there are many confusing statements of the Bohr effect, but to explain this Bohr effect in one statement, it is increase in PCO2 and increase in H plus ion concentration favors O2 release. Okay, so basically this is the Bohr effect. So these conditions are present at the cellular level. So what happens when a blood vessel is carrying oxygen to the tissues? So the tissues is continuously metabolizing. So increase in PCO2, like the partial pressure of CO2 is increasing, the lactic acid is increasing, acidic conditions are there, so H plus ion concentration is also increased. So what happens? This condition favors O2 release. So what happens? The 2,3 biphosphoglycerate, the 2,3 BPG, basically it accumulates the central position of hemoglobin with where the O2 is bounded. So the O2 is released and the 2,3 biphosphoglycerate is bounded on that position. Okay, so basically a release in oxygen to the cellular level, so to continue its metabolism. This is the Bohr effect. Okay, now there's one question. If a person is exercising, okay, so which will be the condition, like what will the body prefer, to shift to right or shift to left? The curve, yes, you're right, the shift will be to the right. Why? Because lactic acid accumulates in the muscles, as we have studied earlier, increasing acidic conditions, increase in the hydrogen ion due to acidic condition, increased temperature of the body, therefore increased 2,3 BPG, and delivery of O2 will be increased. Since increase in 2,3 BPG, it will accumulate the central position and it will release O2 at a faster rate. Okay, this was the reason where in exercise the shift is towards the right. So now one applied part of the oxygen transport I will like to mention is hypoxia. Okay, so there are 4 types of hypoxia. The first is hypoxic hypoxia. and I called it as a true hypoxia. Basically, hypoxic hypoxia is decrease in atmospheric O2 or alveolar O2. Okay, so basically this I prefer calling it as a true hypoxia. Okay, so basically this is caused due to some impairment of the respiratory membrane. Then the venous and the arterial shunts are there sometimes. So these are the causes. Then second is the anemic hypoxia. So what is anemic hypoxia? So basically what happens is, in anemia, decrease RBC as we know, so decrease HB. Okay, so decrease O2 capacity, or rather to say decrease O2 concentration. Okay, so if decrease O2 concentration, it will automatically be a hypoxic condition. Okay, the third is the stagnant hypoxia. So basically the stagnant hypoxia is nothing but it is a circulatory defect. So it may be a blockage if, for example, in the lower limb, if the femoral artery is blocked. Okay, if the femoral artery is blocked, so blood is not going there. Since blood is not going, some RBCs and all are not going, so RBC will not going, so the O2 concentration or the hemoglobin will be less. Okay, so this is the stagnant hypoxia. And the fourth one is the histotoxic hypoxia. So what is histotoxic hypoxia? Basically, it is poisoning of cellular oxidation enzymes. Okay, so what happens is the cellular oxygen oxidizing enzymes are defective. So defect in cellular oxidizing enzymes. So if oxidizing enzymes are not present, so it will causes like the membrane will be like O2 will not be accepted, and oxygen since oxygen not accepted, metabolic activity will be not there. So it is a type of hypoxia which is caused due to that defect in the cellular oxidation enzymes. Okay, so now going to the effect of hypoxia. What is the effect? So a chronic hypoxia can lead to death. Okay, so chronic hypoxia can lead to death as no enough O2 is going to the tissue. Like if the in as we saw in the stagnant hypoxia, the circulatory defect, if some blockage is there in the cerebral circulation, so it may cause death because it is a very serious matter when it comes to the cerebral circulation. Okay, so effect is ultimately death. Now the treatment. So basically the treatment is oxygen therapy. Okay, so oxygen therapy, or in cases of stagnant hypoxia, some surgeries can be performed to remove the clot and all, or like some in cases of myocardial infarction and blockages kind of thing, open heart surgeries and all is performed. So it is a case of stagnant hypoxia. But basically in hypoxic hypoxia, a patient can be given 100% O2. Then in anemic hypoxia, also the patient can given be O2, and also blood transfusion and all can be done. Okay, so this was all about the treatment. So now we will move to CO2 transport. Okay, CO2 transport. There is not much to talk about CO2 transport. Basically, when we go to the CO2 transport, so basically we get 70% of CO2. Let me write 70% of CO2 is in form of bicarbonates like H2CO3. Okay, then like a less percentage is carbaminohemoglobin, and less it is in a dissolved form. So 70% of CO2 is in the form of H2CO3. Then what is this reaction? Basically the H2O reacts with CO2, like when it comes like when metabolic processes is done, so CO2 is one of the byproduct. So H2O plus CO2 in the presence of one enzyme, carbonic anhydrase, we get H2CO3. And also in the H2CO3, it is a reversible reaction with the same enzyme, the carbonic anhydrase. So basically what happens, it gives H plus plus HCO3 minus. Okay, so these were the reactions in the CO2 transport. So basically H2CO3 is the main compound to transport CO2. Okay, to talk about the CO2 transport, Haldane effect. Let me just mention the name. Haldane effect is very much important. Okay, when we talk about the CO2 transport, Haldane effect is the most important. So basically what does this Haldane effect says? We have seen in the Bohr effect, binding of increasing H plus concentration and increase in CO2 concentration favors O2 to release from the hemoglobin. Okay, the reverse is also true. Okay, so what happens in Haldane effect, basically increase in O2 concentration can displace CO2 also from the hemoglobin. So Haldane effect, let me tell you one thing, like when we perform a normal ventilation or normal breathing, so what happens, we inhale O2. Okay, like we inhale all the gases basically, but particularly we inhale O2. Then this O2 is sent from the lungs to the like in the tissue level. Okay, at the tissue level, the metabolic processes occur, the O2 is taken up by the the tissues, and the CO2 is sent through the blood to the lungs back. Okay, and from the lungs back, the CO2 is exhaled out from the atmosphere, and new O2 comes in the circulation from the normal ventilation. So in this story, okay, this is a story where there is an exchange of gases. The Haldane effect says if increase in O2 concentration will displace CO2 from HB, as binding with O2, HB becomes a more stronger acid. Okay, so if there is increase in O2 concentration than CO2, the HB can bind to O2, and this leads to formation of a more stronger acid rather than binding to CO2. Binding to O2 is favorable as much more stronger acid is produced, and therefore it is more favorable. Okay, so CO2 is released. So I have told you a story. So we inhale O2, it goes to the tissues. Now in the tissues there's a catch. Okay, let me just draw something, it will clear your concept. Okay, so basically I'm drawing it in a very basic manner. Okay, so basically I'm drawing the lungs, a very basic diagram, but a very conceptual diagram I am drawing. Okay, so now tell me one thing, this is the lungs and these are the cells. Okay, now tell me one thing, when we inhale, it goes to the alveoli. Okay, now basically we are inhaling O2. Now tell me one thing, when we inhale O2 at this level, just a second, at this level what happens? I am drawing one more basic diagram. Okay, so basically in the lungs, this is the respiratory membrane. I am drawing the respiratory membrane, a very basic diagram of the respiratory membrane, not mentioning all the 6 layers, only one block as the respiratory membrane. So this is the atmosphere, this is the alveoli cell basically, and this is the, like, just a second, this is the blood capillary. Okay, so we have O2 in the atmosphere. Okay, now what happens, the concentration of O2 is more in the atmosphere, or rather to say, this is not the atmosphere, this is the inside of alveoli, or not to confuse you, this is the terminal, or I will write it alveoli, you will get confused. Okay, so let me just tell you, this is this portion, I will just highlight it, the inner portion is this. Okay, I will not confuse you. Okay, so there is increased O2 concentration. Why? Because O2 is from the atmosphere, and in the blood it is reversed, it is increase in CO2 concentration. Okay, so what happens is, Haldane effect is effective in the lungs. Okay, so it is in the lungs. Okay, so at the level of lungs there is Haldane effect. Let me write it in very big handwriting here. Okay, you will understand why. So what happens, since there is increased O2 concentration, okay, increase in O2 concentration in spite of increasing CO2 concentration, CO2 concentration is comparatively less than O2 concentration. So what happens, there is a molecule. Okay, let me just draw that molecule too for you. Okay, the molecule, this is also a basic diagram, the Hb molecule is holding CO2. So what happens, since there is increase in O2, this O2 will go in the blood. Okay, and bind to Hb molecule. Why? Because increase in O2 concentration will make the Hb a stronger acid, and simultaneously it will release CO2 in the alveoli, and similarly from this cell CO2 will be released. And where will the CO2 go? Yes, the CO2 will directly go from this structure to out of the atmosphere. This is Haldane effect. Haldane effect is beneficial in expiration of CO2. Now you understand why increase in O2 concentration in the alveoli basically displaces CO2 from the blood or from the hemoglobin molecule. The CO2 molecule comes in the alveoli and further goes to the airway pathway, and from the nose it goes in the atmosphere, while the O2, which is accepted by the Hb to make it as a more stronger acid, this O2 directly goes to the cellular level. Okay, so I will just draw this capillary. Okay, it is going to the cells. So what happens at these cells? Now tell me one thing, this capillary contains hemoglobin molecule, and this hemoglobin molecules contains O2, and this O2 is bounded with Hb. Okay, now these cells are very active cells, they causes metabolism, metabolic activities are done. So what will happen, there will be increase CO2, increase H plus concentration, increase lactic acid. Okay, so what will this do? Yes, you guessed it right. It is the Bohr effect. Okay, the Bohr effect. So what happens is these condition will cause this O2 to release in this cells. Okay, and the cells will act metabolically. And basically what happens, since the O2 is released, this Hb cell is empty. So the O2 release will be facilitated by the acceptance of CO2, and then the CO2 will go like it will go here, and then the Haldane effect will occur at lung level. So Bohr effect at the cellular level and Haldane effect at the lung level. So this was all about the CO2 transfer. Okay, so Haldane effect and Bohr effect. So Haldane effect at the lung level, Bohr effect at the cellular level. This is the most important concept and a most beautiful concept explained by me.